the seriousness of the COVID that is in there, we have come up with a standard treatment protocol in our urgent care. That is, we are giving azithromycin, which is Zithromax, which is Z-Pak, which is an antibiotic. And then we are combining it with hydroxychloroquine, which is actually an anti-malarial drug. And it is also used for people with like chronic joint pains and rheumatoid arthritis. It's also in a class of a medication called disease modifying agents.
Like, did you feel like it was a dire situation? Like, I'm not gonna make it. How sick were you?
I felt like I was gonna die. I've never, I pride myself on, hey, I'm from Detroit. My blood type is Old English D. I'm ride or die Detroit. Nothing scares me. I'm not scared anywhere. I have never had anything in my life shake me to my core like that. And I have never been so afraid in my life. And I honestly thought that I wasn't gonna make it.
Were you weak? Could you not function?
I couldn't hardly breathe. And I was trying not to panic. I was trying not to make the situation worse. But I felt like I really didn't have a whole lot of time. I felt like I really only had hours.
Wow. And so your Lyme disease that you spoke about, did that ever come into play where you were thinking, okay, something might be going on with that?
I thought about that, but what was always in the forefront of my mind is the fact that how I was breathing. I've been dealing with the Lyme disease long enough to know I've been dealing with that for years. So my whole thing is I've never had anything where I felt to a point where I can't breathe like this.
And at this time, so your husband, is he sick at the same exact time as you are?
No, he had gotten over the hump. He had gotten over the hump with it, and only thing he had was the cough. He had 5 days of a cough, a horrible, horrible cough.
Wow. So at this point, fast forwarding, you get the prescription from Dr. Arsiwala. And then after that, how long does it take? Give me the breakdown of the time frame. So the point of when you receive the prescription to the point of when you start feeling better and all that.
Less than 2 hours. Less than 2 hours.
And how long ago was that?
That was on March 31st.
My approach to this is right now, when we are having this small cohort group of patients that are very sick, that have cough, that have chest congestion and tightness, we don't want them to slip into a very significant illness so that they have to be put on a vent. With the significant shortage of ventilators in the hospitals and the critical care centers that are getting bottlenecked, I think it's very important for us to kind of try this out at least. There is no harm. The problem with hydroxychloroquine is long term, it does have a problem for vision problems with that, but that is somebody that is using for over 6 months period of time. And that's the recommendation. And the dose is much more smaller that we are using right now. The second thing is they could have problems with the bone marrow and other immune suppression with that. But that again only applies for using for a long period of time. It also has implications on prolonging the QT interval in the heart. So it has implications on the bone marrow, implications on the heart, and then implications, of course, on the vision of the individual. But those studies are mostly longitudinal. So short term, when we're giving these doses, it seems to be working. And interestingly, the Z-Pak that we are using has a lot of antioxidant effects also. So there's some degree of, we call it a superoxide effect. So that's a macrolide group of medicine. So right now with the COVID, there is a lot of new information that keeps coming. And to answer your question, the FDA did say that we're going to leave it in the hands of the clinical providers to use it or not use it.
Okay.
Case to case basis.
And of you said 56 patients that you've encountered, how many of them have had to have this treatment?
Out of 56, I think no more than 12 patients have had this treatment. So if you see the majority of the patients, we are just telling them to go home, drink plenty of fluids, take a lot of precautions of not touching their eyes, nose, or mouth. We are telling them basically to wash their hands often, wear a mask to protect and stay in isolation. Normal period of isolation is we are suggesting that from the last day of your respiratory symptom, you need to say 5 to 7 days from there on. So that means the day you finish having your cough and your nasal discharge and other symptoms and your fever goes down, you have to take about a good 5 to 7 days after that, and then you are deemed that you're not, positive for this. Or so that's what we are saying.
I'm happy to be alive. I thank God. And, I do. I do. I thank President Trump for what he's done.
How
And
does that factor into this for people who don't know?
for how he factors into it is that, on a local level, if you have government officials that are blocking something that you're trying to get and to receive, if it's being blocked, a federal level can override that. And if he had not been pushing it on a federal level, I would not have had access to it and I wouldn't be alive today.
Would you have even known to ask for it?
I would have known to ask for it, but I would not have been able to access it. And that's the difference. Being able to have access to it is a completely different thing. You can ask all day long, but if you don't have access to it, what does it matter?
Yeah. Just to wrap it up, a lot is being said, and I'm so glad you're doing better and your husband is doing better. But a lot is being said about how it's unproven, this treatment. I know that your doctor told me that he has had no complaints and no complications at this point. Obviously, there's a lot that scientists and doctors are still trying to learn about it. But what would you say to that part of it? We don't really know. It's an unproven treatment as far as the FDA has said when it comes to COVID-19. What would be your thought about that?
Well, my thoughts are on it as this, if you have an opportunity to receive something and it's a choice between taking this pill and a machine to keep you breathing, you tell me what your choice would be and you make that choice. That should be between you and your doctor, period. I know I made the choice and I'm glad I made the choice and had the ability to make it. And I'm here to talk about it. The choice is yours.